As the saying goes, it can happen to anyone, but it's more prevalent with age and in men with certain health conditions like diabetes, high cholesterol, or high blood pressure. Erectile dysfunction. Studies estimate that half of men between 40 and 70 will face ED to some extent. So what should men know when it comes to their sexual health? And it is a topic that I think a lot of men feel uncomfortable discussing openly. Do you find that?
Sure. Yeah. Obviously, it's a very private thing. Sex is something that's supposed to happen in private, so when you have to talk about it more publicly, it's never easy.
And it doesn't get the attention it deserves, given how prevalent it is. There are millions of people in Canada and around the world that deal with it.
For sure. Yeah. It's a very common, like you mentioned, stats, and that's just a general rule of thumb that we look at, sort of the percentages per decade. So in your 40s, maybe 40% of men experience ED at least, at some time, or in your 50s, it's 50%, 60s is 60%.
And so on.
Sure. Yeah.
So what's the first sign?
Well, the first sign may be that a guy might notice that he's not noticing, morning erections like he used to notice, right? Or and then it could be that it takes more focus or concentration to achieve an erection during intimacy. Then he may notice that he's experiencing earlier ejaculation or without a full erection, things like this. You can see why it's not as easy for guys to talk about sometimes. And then it may be difficulty maintaining an erection to allow for satisfactory relations. So kind of progresses along those lines.
It's interesting because when you look at our healthcare system, there really isn't a lot of time to speak to your family doctor about these things. You go in, you get 15 minutes, you want to check the most important subjects, your heart, your prostate, whatever it may be. And ED, I wonder to what extent it gets left behind.
So truthfully, that's very accurate, because we focus on the, quote, sexy big ticket items, heart health, heart attacks, these kinds of things. But in the practice of most vascular disease specialists, whether they're interventional cardiologists, general cardiologists, vascular surgeons, we do a vascular survey, right? Something that tells us whether or not the vasculature is functioning normally outside of our particular area of specialty. So in my case as a cardiologist, I ask about peripheral vascular symptoms, and amongst those things is erectile dysfunction, because one of the most common reasons for people getting erectile dysfunction as they get older, particularly in those who have cardiovascular risk factors, is vascular disease, troubles with blood flow into the base of the penis that allows the maintenance of an erection. 70% of people who have heart artery disease, coronary heart disease, have a peripheral vascular disease. And so knowing that the two keep such close company, I think it makes sense just to screen for both every time you see your patients.
It's true. It can be a clue to other things. Usually it's not a standalone issue. There are usually other things that are happening in a man's body that may be causing it. Is there a relationship with the prostate?
Well, coronary artery disease often will occur a little bit later, and erectile dysfunction is almost the canary in the coal mine. So one of the things to flip it around from my colleague here is when I have a man coming into the office in his 40s and 50s with erectile dysfunction that's clearly vascular in nature, it's not emotional, psychological issues, I will actually make a referral to see one of my cardiology colleagues for them to get a stress test, echo, cardiovascular workup, because again, the arteries, the blood vessels in the penis are very, very small, and they're more likely to get affected earlier than the big blood vessels in the heart. So you may have erectile dysfunction maybe 5 years before a coronary heart event. And so it's a big predictor of other major things going on. They may have undiagnosed high blood pressure, diabetes. And so again, it's a window into the man's overall health.
That's why we sometimes see patients on anti-erectile dysfunction medications, which after their heart attack need to be adjusted because they've had erectile dysfunction for 3 or 4 years, and then they end up on nitrates to deal with chest discomfort, and that's what ends up cluing them into the fact that these are all connected.
It's interesting because as a woman, and thankfully we haven't had to deal with that in my house yet, my husband and I are still fairly young, but I imagine it would be hard for any woman. They might blame themselves, and that could put real pressure on a marriage. Have you seen that?
Yeah, it's really difficult. And it's understandable that the partner's gonna personalize it. But when the physiology is out, so all these men, everything is checked off, what we see is, intimacy is really about allowing oneself to be fully seen by another person. And we have a lot of men that have built a history of kind of closing themselves in. And so there's a process with treating ED that we've got to get them opening up, but opening up to their feelings, their emotions, and then having the courage to share it. And that is gonna move away from the normative kind of gender roles. It's kind of a courageous step to take. But the men get to the other side. But the process is, hey, am I ready to allow myself to be fully seen, and what will that look like? And so it's amazing that we're talking about this here, and just it's so much courage for a guy to say, hey, I want to try to do this process. And the partners are definitely going to be impacted. And it does make the treatment harder if it gets kind of that kind of power struggle about, hey, what's going on? Is it me? Is it how I look? Is it that I've gained weight? We hear that all the time, and that's definitely not the case.
So let's talk about treatment. What should men do? What is the first step when they find themselves in this situation?
Well, you know, get checked, see your doctor, and that's the problem, because although we mentioned stats that 50% of men in their 50s have some degree of ED, marketing companies are very frustrated because they know that they're not tapping nearly that many men. So a lot of men aren't going to the doctor about their ED, and that's, you know, that could be a lot of things. It could be that it's not a priority for them. It could be that they don't have a mistrust of medication or of physicians. Who knows? But regardless, it would be really nice for the reasons that Dean and Sanj were talking about it being a precursor to more serious cardiovascular disease. It would really be great to reach those guys. We could save a lot of lives, right? So I'd encourage men, if they're watching, to even if you don't want to treat your ED, see your doctor.
But is the default the little blue pill? Is the default Viagra? Because I do wonder if there are other causes, then could Viagra be problematic for people if it's being driven by cardiovascular disease?
You probably need the Viagra anyway. You should, but see your doctor to get checked. The Viagra is not much of an issue. It's quite a safe medication, and it can, help the relationship. It can help self-esteem. It can help depression while you go ahead and see your doctor about your cardiovascular risks and your prostate risks.
Viagra is a symptom fix, right? It's not an origin fix. So if the symptom of a vascular problem is erectile dysfunction, the Viagra can help manage that, but that ultimately doesn't reverse the fact that there is vascular disease. And that's all about risk factor control.
This is such a huge topic, and it could be an entire show, but we'll have to leave it there. Your questions and comments are coming up next. Don't go away.